Welcome to the Wellness Revolution podcast.
Okay, welcome again to the Wellness Revolution podcast. Today, we're going to talk about our birth, our own birth, and the trauma that surrounds it. And yes, you know that birth, although we color it as this beautiful, wonderful thing, and yes, it is when a new life comes in the world, the trauma surrounding birth, it's painful, it's work, there's been a lot going on. Sometimes things happen before we're born that can be traumatic. Do you understand that we know and hear and feel what's going on while we were in our mother's body? And so let me just give a little background about this. I have a lady on, we're going to talk all about this birth trauma. And as I like pull her stuff up, I was just looking. I want to talk a little bit about my birth trauma, but I'm going to bring on Margolis, and I hope I say Margolis right. HomeSweetHomeBirth.com. HomeSweetHomeBirth.com. No, you don't have to have a home birth. There's all kinds of other ways that you can do it. But let me just say that when did I experience my own birth? And I don't want to necessarily say it's a trauma. So we use the term reborn and things like that. Once I had a past life regression, and part of the past life regression was going back and back and back into your previous history, into your childhood, and even back into your mother's womb. And I remember that interesting experience because I'm in there, I'm bathed in the water, I'm looking around, I'm mostly comfortable, but I can remember times where I could definitely tell you that my mother wasn't happy. And it wasn't that she wasn't happy that she was having a baby. It's just her whole life she was questioning at that point in time. I found out later on from my mother, actually before I went back to this, I remember my mother saying to me, you know, my parents are now divorced and have been divorced for a lot of years. My mother said to me one time, you know, he wasn't acting right even back before you were born about my father. And now let me just say, my father is, if you want to say not acting right, we're not talking about somebody who was a drunk or a drug addict or, you know, any of those type of things, an abuser, any of those type of really just horrible, reprehensible things that people deal with. My father, I would call him kind of neurotic, a little bit. He suffered from depression, and he's just a little weird. He's a geek, and he was an electrical engineer, really into organs and classical music, was the chairman at one time of IEEE, and he was just into himself and that stuff, computers and engineering stuff. So this is kind of what it is. So he was a little bit emotionally detached, I would say, and now knowing him more emotionally, I would call it kind of immature from a social perspective. And so my mother was dealing with that because she's married to this man. She has one child. I'm in the womb, and she was feeling uncomfortable with the situation enough to at a point said to me, hey, he wasn't acting right back then. Okay. So guess what? When my mother's upset, that's traumatic to me in her womb. When I come out, you see things in your home. But this is not the typical trauma that we talk about. But yet, it's something that, because I can even tell you about it and remember and hone back on the moment that my mother told me about this relationship with my father, this is obviously something significant. And I remember going into a regression before I was born and seeing my mother unhappy in that situation. And I knew, though, it was not about me. Still traumatic to see your mother unhappy. So I want to bring on Margolis because she does all this cool goddess birthing stuff. And she's a licensed certified midwife, OBGYN practitioner, yoga, all the other good stuff. And we're going to talk about what's called Clarity Breathwork. But we all have birth trauma. And there's women who want to make it, how do I make this as beautiful as possible for me, my baby? If you're listening and you're past the point where you're thinking about having a baby, think about this in terms of your own birth and trauma and some situations in your life. But also, this is something that you may want to recommend to other women who are going to go into childbirth at times. So, Anne, welcome to the Wellness Revolution.
Wonderful to be here. And let me just clarify, the website is Home Sweet Home Birth, but it's really how can we restore humanity and bring that model of care and celebration to the birthing process, empowering women, whether they're birthing at home, in the birth center, the hospital, or even in the operating room. Okay, so it's not just about, it's supporting women's choice, but having that restoring humanity to and celebration to the process of giving birth.
And I gotta say, I applaud you to say we're celebrating women's choice, because yes, we get into these times, especially as women, where we get very judgmental on how people do their life. And so people are into, oh, I want to do it natural. I want to do it this way. I want to do it that way. And it's like, you know what? The goal is to have a healthy baby. And however that happens, do it that way. And don't get upset about it. You don't know what's going to happen surrounding the birth of your child. The best laid plans may not turn out the way you want them to, and you may have to go a very different way than you expected. And so we should roll with that. And so I'm happy that you didn't say everybody should have a midwife and a home birth.
No. But the goal of modern medicine is everyone should have a healthy, physical, breathing baby who has a heartbeat. And the goal of my care and my mission in the world is to have a healthy baby, mind, body, heart, and soul, as well as a healthy mother, mind, body, heart, and soul. It's not just about a healthy baby physically. And that when a woman has a traumatic birth experience, everyone de-emphasizes or doesn't even account for the significant psychological impact of her experience. And they just say, but you had a healthy baby. So that totally invalidates, her experience. And I had my own birth trauma which made me very passionate about preventing and healing, helping others heal from it using effective modality that I'll talk about.
Yes, and that was the next. I said, so you got to tell your story because that leads right nicely into why you do what you do now. So let's go back to what happened to you.
So I'm now, a lot of women that are probably listening gave birth around when I gave birth, or they gave birth, or let's say people are older, they gave birth earlier, and some gave birth later than I did. But still, the routine medical model of care around birth can lead to a lot of birth trauma. And so I didn't know this when I was an obstetric nurse. I graduated from University of Pennsylvania. I was all primed for natural childbirth and the beauty of birth. And, I applied for my first job at, we had to do med-surg nursing before we could do obstetric nursing. So I was this obstetric nurse I was in my 20s, and that's when I developed fear of childbirth. And because I never saw normal, birth was a crisis waiting to happen. Birth was a medical emergency. It was a disaster waiting to happen. And we need to prevent, it was like a potential lawsuit. Every woman coming in was a potential lawsuit. So I was, as a nurse, having to rescue a lot of the problems because of the standard routine interventions that were done to healthy women coming in to have a baby. So of course, several years of that, I wasn't seeing good outcomes. Not everything was good. I saw a lot of neonatal intensive care admissions. I saw moms and babies dying in childbirth, and I was, I have a very sensitive heart, I'm taking it in. And I was seeing more, I was a nurse at cesarean section, a major operation, more than it seemed like I was in a vaginal birth as a nurse, right? So of course, when I get pregnant, I'm full of fear. and fear, as we know, and inner stress is sort of like is so many of the modern dis-ease, mentally, physically, psychologically in the world. It certainly is one of the enemies of labor. And even an animal who is afraid, like a deer is trying to have a baby, a cat is trying to have a baby. If a predator, if like a deer is seeing a tiger in the wild, that labor will stop. and she will get into the sympathetic nervous system fight or flight, and she will run, you know, and when she feels safe and away from the tiger, then she will have her baby. Human beings are very similar, and the mind body is very connected. So what happened to me was I just went in with a lot of fear. I took Lamaze, and I was given the royal treatment. I was a staff on the unit having a baby, right? So everybody meant well, but you know, the first thing that happens is you put on a hospital gown, which disempowers you right away. You think they're in charge, I know nothing, you know, and I'm sick. You know, it creates a dependency. It's even in the hospital now, I encourage women to wear their own clothes. But that being said, I took off, you know, I wore a medical gown, a hospital gown. I was not allowed to eat and drink. You try running the New York, you know, the marathon, 26 miles, which is kind of like, you know, labor is a huge athletic event for the body without food and, you know, nourishment and fluids. So, but at least, you know, they gave me IV fluids. I was strapped to a monitor, so that meant I had to stay still in a bed. Now, that goes again, now as a midwife, I know women, when left to their own devices, you know, instinctually will be upright because we need gravity to get the baby down and out. And the pelvis is 3 bones connected by ligaments, so kind of position changes can actually increase the diameter of the pelvis. When you lie down, the pelvic diameter is smaller. And also it's more comfortable to be moving and rocking and being upright. But anyway, so just those routine things, even in a natural birth, already set me up to fail. So the doctor came in, I was on a time limit, you know, every hour I had to be dilating 1 centimeter. And I wasn't. The doctor kept coming in without even asking me, which is one of the main causes of birth trauma, that they equate it with a rape. And it needs to be taken as seriously as a rape, as I have no control. A man is coming in and sticking his fingers up my vagina and checking me internally, which is uncomfortable, and then walks out. And I heard him kept saying outside the room, she's still 4, she's still 4, she's still 4. And at one point I heard him tell my colleague, the nurse, hang pit. Now I know what that is. I know that means Pitocin. Not everybody else would know hang pit, what that means. She comes in, and now you have to understand, my biggest fear was ending up in the operating room, having major abdominal surgery. My biggest fear, because I'm a dancer, I'm very athletic, I do yoga, that was my biggest fear. And then the other biggest fear was having a damaged baby, because I've seen them. And so she said, you know, she was putting the pit in my IV, and I said, no, I don't want that. She said to me with love, oh, but honey, you don't want a cesarean, do you? No, you know, I'm vulnerable now, right? So she feared me into, okay, give me the pit, right? I don't want a cesarean. Well, of course, the Pitocin made the contractions harder, stronger, more intense, closer together. And my Lamaze, my ability to cope, went out the window. And then, of course, came the epidural. Now, once I was given the epidural, which is a shot in the you know, giving anesthetic around the fluid of the spinal cord, immediately my baby's heart rate dropped to such a dangerous level. They call a stat emergency cesarean. So my biggest fear is happening. There's this ER scene, people with very frightened eyes and rushing, and, you know, and I was whisked off into the operating room. And then I was in the operating room, you know, they prepped me and I'm by myself, 15 minutes, 20 minutes, 40 minutes, an hour. Nobody was monitoring my baby. Nobody was monitoring me. They wouldn't let my husband in. And in that time, I was convinced I moved from my baby's damaged to my baby is dead. That's, you know, that's what it was like lying in the operating room by myself for this emergency cesarean, because my baby had bradycardia, terminal bradycardia, the heart rate went down real low. So the epidural caused me to open, and I'm pushing. It was a miracle, right? So I called for help. They were waiting still for the assistant surgeon in a hospital that called for an emergency cesarean where you need to get the baby out in 10 minutes, right? Yeah. So I'm pushing. I call doctor. I'm help. I'm pushing. Baby's coming, you know. And he comes running in. He's in a panic. He screams for a vacuum, which is like a baby Hoover where they stick a suction on the baby's head, and he cuts a huge episiotomy, which is and he pulls her out. She was pink, breathing, had a heartbeat. They didn't even need to resuscitate her. They say she's fine. I was not fine. And now I know that the trauma I feel, you know, just like we know that drugs, smoking, infections, alcohol, poor nutrition, chronic, you know, goes to the baby. So does the hormones of stress and trauma, right? So I did not know I was traumatized, and everyone was like, I knew that I didn't feel right. You know, I was having nightmare. You know, now I know what is called post-traumatic stress disorder, which is a normal reaction to a traumatic event where you're not in control, where things are happening against your will, and you're afraid of something very serious like a death or damage to you or your loved one, right? I was having nightmares. I was having recurrent memories of it. I was having I loved my baby dearly, but she reminded me of it. I think it interfered with my early bonding, even though we're very close and I love her dearly. I avoided any talk of the birth. Anyone wanted to talk to me about it, I couldn't handle it. It triggered panic. And so much so that I couldn't even imagine going back to work. You know, when it was time for me to go back to work. But, you know, everyone was like telling me, you have a healthy baby. Like, you know, just focus on that, you know? So I tried to do that, but I felt very isolated and alone because the medical community doesn't know what trauma, like doesn't associate any psychological effect of birth to that, to birth, to women. And they don't know birth trauma. So I didn't know about birth trauma. So I just thought something was the matter with me. Why is it just me? No, I had no one to talk to. Anyway, I sucked it up and I went back to work, right?
I want to like jump forward a little bit because we could talk for hours.
Oh, okay.
Because this happened over hours and days. So you had this traumatic birth experience.
Twice.
Twice.
Same thing happened my second baby.
Traumatic birth experience twice, and we won't go into the gory details about the second one.
Right.
But let's fast forward. When did the moment come that you said, I have to do something about it, and I know what to do about this? So give us a little bit about the transition, because we want to give women the answers.
Right.
So stories like I'm sitting on the edge. I've been an OBGYN. I've delivered babies. I'm going back to my own traumatic birth experience that I never, not mine, but one where I had, one of my sons was, kind of wild and crazy. I'm sitting on the edge. I'm maybe going to go into C-section. It turns out I didn't, but cord wrapped 4 times around the neck meant there were issues. So anyway, what gave you the idea, and then how did this come into action? Because I want to take some time to talk.
Right. So a friend of mine, I was talking after my second birth. I was and after continuously having to rescue mothers and babies from this sort of treatment, which is very standard, that happens to most of us, and even worse, a few generations before, when birth was moved to the hospital and taken over by the field of obstetricians. And we need obstetricians. But they really are specialized for high risk and complications, and diagnosing and treating them medically and surgically. So we need them for the small percentage, right, who do need that kind of care. But I was talking to a friend of mine about my frustrations. She says, "Why don't you be a midwife?" And I'm like, "What's a midwife?" I really didn't know. I went to the library. She told me about it. We didn't have internet then. I went to the library. I read everything I could about it. And I'm like, absolutely. I applied. And it's a post, you know, in New York, you have to have your bachelor's in nursing. And then you have to have your master's. It's a postgraduate degree. And in midwifery school, I came home. It was like all of the crises and complications and surgery and intervention became the exception rather than the norm. And I was seeing calm. I was seeing a family celebration. I was seeing the holy. I was seeing that birth is normal, that women can birth like they can breathe, and babies know how to be born. And so I was seeing women come out empowered and loving their experience, even though it was challenging. And I really felt I came home to hold this space. But, you know, for me to authentically, I became very passionate about this is the kind of care I want to give for women so that mothers and babies can have a beautiful birth. A mother is birthing herself each time she births a new child, and the baby is being born. I wanted to create an experience that she will love and cherish forever, and not have any kind of, you know, do my part in preventing birth trauma for either of them, and really helping to create an experience of joy and empowerment, like that she finds her strength and she loves and treasures her experience, but authentically. Because of what happened to me. I got pregnant 2 more times, but the first time I said to my midwife, for me to authentically promote this for every woman, I need to experience it. I'm scared. And I don't think I healed from my trauma. I really don't. I mean, it came up even more with my 3rd pregnancy, and I had been in midwifery school already. She says, oh my gosh, don't worry. This birth is going to be so healing and so different, blah, blah, blah. I didn't really believe her inside. But when I experienced that kind of care, she held space and encouraged me, and everything was done with my consent, and she gave me back my power.
So wait, stop. I want to know, what is that kind of care? Because you're saying that kind of care. And
the kind of care is treating just like what
you don't know anything about what the birthing experience is like. That's number one. So, and number 2, here's my question, and I'm sure it pops up to everybody. How do I know that I'm not the person that's going to be the complication and I'm going to need something bigger deal? How does that get worked out?
Well, you know, we don't know. Sometimes we have to, you know, but when a midwife has has expert in normal, which is the vast majority of people.
So we know how to experience. What is the experience?
It's birth is normal till proven otherwise. You know, my initial visit with a woman, it's mind, body, heart, and soul. You know, my initial visit with a woman is 2.5 hours. We build a relationship. Birth and pregnancy are normal until proven otherwise. We give the power back to the woman. Nothing is done without consent. We encourage her to incorporate, as a midwife, I encourage women to bring pleasure, to tap into their power in their life, in their pregnancy, in their birth, and as a woman, right? Birth is a celebration. It's not a medical event. It always was a celebration in community throughout the world. It still is in the majority of countries around the world. So yes, we can screen, we can intervene, but we don't do anything. It's first do no harm. And Michelle O'Don, who is a famous, very outspoken, world-renowned obstetrician, was at a midwifery conference, and he said, what is the best intervention that an attendant can do at a birth? And there's 450 midwives in the room. They all got it wrong. You know, anyone who was raising their hand got it wrong. And what would you think the answer is?
Nothing.
Yeah. To knit. Why? It's this seasoned, calm midwife or doctor who has seen thousands of births, heart wide open, eyes wide open, ears wide open, can talk to the woman and remind her of her strength and her power and help her calm and help her find her calm and her strength and reassure her and, you know, give her love, but his hands are occupied and she's exuding calm. So the atmosphere in the room is calm. And that, yes, he can put down the knitting if we need to deal with something. And, but it's first do no harm, which is the part of the Hippocrates oath, that even physicians have to take, right? When graduate, correct? First, do no harm.
So now let me ask a question about this, because this is, the time where people sue when they spill coffee on themselves. So how do we get from the point of, and here's what happens when you're a doctor, when you're a doctorate in healthcare. This is my podcast, so I can say it. Shit happens. Shit just happens, and you don't even know why it happens, and just shit happens. So how do we get to the point where shit happens and it's not all of a sudden we can make it into a better event and not make it always into a litigious event? Because what happens is why the system is the way it is today, because every doctor is covered doing the CYA, OBGYN, and my friends who are OBGYNs, they have $100,000 policies, and it's miserable because you don't know what's going to happen and who's going to come in and sue you. So you do it may be bad for trauma nurse and everything like that. And there's horrible stories, but it's like, you know what? I got to do it this way because this is the standard of care. And if I deviate from that standard of care and something goes wrong, that's the end of my life.
I get it. But I have never been sued. Midwives are sued, much less. Well, first of all, physicians do take on higher risk clients, right? So one of the things is the relationship. Our visits are an hour. We get to know each other very well. When you have a close, intimate relationship with someone, they're less likely to sue. Also, I'm not intervening. I'm not giving them dangerous drugs that have risks. I'm not, I'm screening. If someone has insulin-dependent diabetes, they're going to be with a doctor, right? But the vast majority of women are healthy. Right. So shit happens. Meconium, we say, happens. Midwives have a thing, meconium happens. But, I don't wait till it's a crisis. And my transfer rate to an obstetrician is 7%. That means 93% of women are doing it. Okay. There are times when, let's say if a woman has a thyroid disorder, right? I will collaborate with a specialist, but she can still have midwifery care. But if she has dangerous high blood pressure, she's going to be with an obstetrician, right? So obstetricians are getting higher, that's their expertise. We need to work as a team. But the high risk care, giving everybody medication and drugs and the way that women are being, monitored, being put on their back, not able to eat and drink on an IV, it creates risk and it creates problems. Women, a much more risk of having a cesarean and not progressing in labor just by that, right? So cesarean is major abdominal surgery. They're doing so many other surgeries laparoscopically to reduce the risk of major abdominal surgery. So women in midwifery care, if I have to intervene, first I'm going to use natural remedies. And sometimes it might be, let's take a walk. Let's dance. Let's take a rest. You didn't eat for a while. Let's go eat something. So some of the interventions, we might suggest are very simple, non-medical, right? If I have to use medical intervention, I do, but it's the exception. I am telling you, I've been thousands of babies, over 2 decades of practicing this way. And I'm not the only one. Like my colleagues, our malpractice insurance is not even a quarter of what what obstetricians are having to pay, because midwives have a much less chance of being sued. But,
okay, so now let me ask a question about this, because you say I'm spending an hour with a patient, or 2.5 hours, and that's the way you create a therapeutic encounter.
Plus, I'm assessing.
Wait. Let's be honest about the way healthcare works today. Most people do not get compensated. Most practitioners do not get compensated well enough to be able to spend that amount of time. And then most people say, I'm not going to be able to afford X, Y, Z, or ABC. So how do you deal with that financial piece?
I voted for Obamacare, but until Obamacare, insurance was paying us well for that
you said until, so does that mean something changed?
Yeah, like the insurance across the board are paying me and my colleagues in all medical fields like less than a third or a quarter than what we used to pay. So most of us had to switch. I like before I could take Medicaid, even with Medicaid HMOs, were paying $6,000 per woman.
Wow.
For the 9 months of prenatal and labor delivery, and then the 6 to 8 weeks postpartum. Private insurance was paying $10,000 to $12,000. Now I know high risk obstetric. My sister, for example, my sister is a high risk, right? So she sees an obstetrician at Cornell. Her obstetrician, even before Obamacare, was saying it's $20,000. If you need a section, it's $25,000. I don't take insurance. Doctors, in order to stay afloat, and midwives, in order to stay afloat, and my father retired after Obamacare. He couldn't take $7 to $30 per office visit.
This is why I'm doing what I'm doing now, because when I voted for Obama, I understood that I was voting against my own interests if I wanted to take care of as many people as possible under insurance. It just is not financially feasible to run a business.
You can't sustain.
Do it under insurance. It just doesn't work from a financial perspective. And I know most patients, clients, people do not understand the business aspect of what's going on. But if I take less than what I'm spending to take care of people, I'm spending money and I'm not even taking home any salary. That gets a little bit old, especially after working 100-hour.
Our healthcare system is broken.
So it is broken, and I don't care whether it's Obamacare or whoever comes, they need to figure out how to do this. But on the other side, I can tell you that people who figure out how to invest in their health get results.
Absolutely.
Because they have decided that they're going to fully play out and participate, and then they've researched, and before they even meet me, they decided I'm the right person. So it's a different kind of relationship other than the person that said, why did I pick you? I picked you just because you're on my insurance.
Right. And so that's the people who are coming. That's the people who come to me. And even people on Medicaid, they work it out. And I'll give them, I'll lower my fee, for people who really can't pay. But now the people in the middle income bracket can't even afford, their insurance premiums went up, and they're not even being covered. It doesn't cover it.
It doesn't cover the stuff. But insurance premiums are crazy now because people call it the Affordable Care Act, but I'm not quite sure who it's affordable to.
The rich.
Because the people in the middle, it's only affordable to very high people. Everybody I know who's an entrepreneur is like last year or 2 years ago, I said, I'm opting out. And I ended up with another plan, Liberty Health Share, which I believe covers this type of stuff. But it was just like, I'm not going to pay all that money and then have $13,000 of deductible still. And then you're not covering anything that I want.
And it takes you a year to get paid, 2 years to get paid. Yeah. But I have found that people who want this kind of care and don't want to be treated like just like a conveyor belt, sort of dehumanized, depersonalized, seeing a different doctor every clinic care, 5-minute visits, nobody's answering their questions or listening to them. They want this kind of care. People will pay to have a wedding. People will pay to have something that they want, right? They will work it out.
I'm clapping because people, you said pay for a wedding, and people pay $6,000 to go to Disneyland. And so people have to retool what they feel is important and what's valuable. You pay for what you value, and you value for what you pay for. So when people can come up with $30,000 to $60,000 to walk down an aisle for a day,
right,
should be able to invest in somebody who's going to help you have a birth experience that is pleasant and a healthy baby, so that you don't have a problem forevermore.
And you know what? And I have seen such kindness. Like I'll put out a group email to all the ladies in my practice, and I'll say, there's a woman that really wants to have this kind of care. She has no money. And I have raised people, I don't even care if it's $25. I have gotten money to support another woman having this kind of experience. That's how passionate people are about it when they have that experience. They want to give back, right? And so I became passionate about it, and that's my mission in the world. That's that I now has gone global. But I want to give some hope to women and babies, because some of us have, like just the standard care, for example. Let's say a baby is in the womb. I mean, now there's tons of research, medical research in neurology, embryology, psychology that documents that babies have nonverbal conscious memory in the womb, right? Yes. So and
talked about my birth experience. So
right. And just think, so a woman coming, so for the baby who is like getting 24-hour womb service, right, heart to heart with mom, is now being given drugs to make the baby come out, harder, stronger, narcotics, they're anesthetic, sometimes they put an internal scalp electrode on the baby to monitor the heartbeat. So there's intervention. They stick they break the water with a hook. Sometimes babies are pulled out by vacuum or forceps, and, bright light, rushed. The medical community is not acting as if the baby's conscious, but the baby is a fully, exquisitely conscious human being that is developing nonverbal memories. Baby is the cord is cut right away, which is severing a third of the baby's blood supply, which is really the equivalent of a hemorrhage. The baby is being suctioned. They're sticking tubes down the baby, put in an isolette away from the mom, working on that baby, doing procedures. Yes. So or if the baby goes to the NICU, the intensive care, that's a whole other thing, right? So people carry nonverbal memories, and that impacts us. But the good news is we don't have to go to years of psychoanalysis, and we don't have to take medication to heal from trauma. And I've had childhood abuse. I entered adulthood, from years of childhood abuse from a mentally ill mother. And I had a lot of different hits as an adult. My father was in a car accident, died very quickly, so I had a lot of hits as an adult. And I knew I was carrying trapped emotional pain and trauma in my body. I tried everything. I went to every.
We gotta like move on, because.
Well, I'm going to tell people that there's. Okay. Well, so anyway, I tried everything, and trapped emotional pain and trauma. The new evidence with the research on trauma healing is through the body, not through talk, not through mind. And what saved my life is what is called Clarity Breathwork. And saved my life. It cleared my body of all the trapped trauma energy. It was like taking off 3 million pounds of tons of bricks that I've been carrying for my whole life. And I became so passionate about that, is that I incorporate that now into my practice. And it's miraculous. I'm in awe of the work. So if people, you can look up online, there are breath workers all over the place. I do it on Skype, but it's, my website, homesweethomebirth.com/Clarity Breathwork. I think it's on my website to learn more.
Your website is homesweethomebirth.com.
Yes.
You can find on there where to find
to find Clarity Breathwork. And what's amazing is that holistic.
Let me just ask one thing.
Add one thing.
Let me ask one thing. Okay. We need to get this clear, because people are going to see this. They're all over the place, and people think, birth, I need somebody who's near me. You're not going to be near everybody. So I want to know, in a snippet, a very short snippet, how you can help people who are not physically near you.
So you can go on the claritybreathwork.com website, right, to locate other breathwork practitioners. There's the, let me just see if there's an internet. Let me just look this up real quickly. I'll give it in the link to you.
Okay.
There's Rebirthing happening all over the world. It's in Europe, in some of the countries, as common as yoga studios. There are rebirthing breathwork studios where people breathe in groups. right? There's several holistic psychiatrists in New York City that recommend, so I recommend it to their clients in an adjunct to what they're doing. And so I've, doing home visits. I'm now coming to the city and seeing people, but, doing this kind of work. So I travel, but like people in California or, it's in Canada, it's in Europe, there are breath workers, and, you can look up Rebirthing. If you give me a minute, I will look up the organization that also, I think it's Rebirthing International, Rebirthing Breathwork International. So it's rebirthingbreathwork.com, International Breathwork Foundation. So IBF Network.com has a list of breath workers around the world.
Great.
And also talks about the science of it.
Wonderful, beautiful. It's just, we want to make sure that people, they say, well, oh my God, she's in New York City and I'm not near New York City. What do I do? I want to make sure everybody has the resources, which is why I do the show, the resources, and understand that if you had birth trauma surrounding your own birth or the birth of your children,
or any trauma,
unfortunately is very normal today. I can tell you as a practitioner, as a doctor, that I've had post-traumatic stress disorder. I can tell you what it's like to be in those situations that you're talking about. I can go back to medical school and remember a particularly traumatic birth where a baby died that had been there. It was a big deal. Everybody was running and everything like that. And then I remember afterwards, the resident who was above me saying, oh my God, now we're all going to be sued. And so there was the trauma of that. And then the rest of us walked around with fear and wonder, oh my God, is my name on that chart? Because if my name's on that chart, now I'm getting sued over what just happened. And I got to say, everybody was running around doing their best to not have a bad outcome, to not have the bad outcome. You got to say, there are doctors there that their whole thing is they want everybody to have a beautiful baby. All the nurses, like when you were an OBGYN, your goal was for everybody to have a beautiful baby. But when stuff goes wrong, it's hysterical, and then everybody walks away, doesn't talk about it, and goes on to the next thing. So the practitioners have a lot of trauma that they've dealt with. So I can tell you all the doctors I know have post-traumatic stress disorder from something that happened to them during their career that was particularly traumatic. And then not only did the person have trauma, they felt responsible for it. And then you wait for the lawyer's letter to come. Yep,
absolutely. And I wanted to just also give your readers a gift. So you go on homesweethomebirth.com/gift, where you can download 154 of my favorite books, resources, which include books like Healing from Birth Trauma, right? It's inspirational books for women, for dads, for moms, for pregnant women, for, living in joy. But it's also, I have some definite resources on there about healing from birth trauma.
Yes. Well, thank you so much, Anne. HomeSweetHomeBirth.com. I want everybody to go check it out because you will get a lot of resources there, and then you might decide you want to move where Anne is so you can have your baby.
Well, but there are breath workers around the world, and if you can't, I do Skype sessions, which are also very powerful. But other breath workers do Skype sessions as well. That you don't not do it if you're really suffering. It's the most effective modality I have personally experienced and witnessed in hundreds of thousands of people. Right.
Thank you so much, Anne. I really appreciate the interview, and thank you so much for your work.
Thank you for your work.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.